All right. So it's 7 o'clock. I'm going to give some folks time to jump on so that they can hear everything that I've got for tonight. So we're going to get started in a couple of minutes. So make sure everybody's able to log in. All right. All right, so I'm going to go ahead and get started. I think hopefully people will just join as they're able to. So it looks like a couple people are on YouTube, and I think Facebook will probably show up in a minute. So I'm going to go ahead and introduce myself. So I'm Renata Jones. If you do not know who I am a licensed Medicare insurance agent. I am a pharmacist. I am a serial entrepreneur. And what I get a lot of times is people asking me, what does it take to become a Medicare insurance agent? And so I figured that I would just share this information with everybody so that you would actually know what it takes to be an insurance agent. You do not have to be a pharmacist, you do not have to be a nurse, you do not have to be in the healthcare industry at all to be a Medicare insurance agent. However, if you are a pharmacist or you have some type of a medical background, to me, it gives us a competitive edge because we're able to better serve those Medicare clients because we know clinically what some of the things mean. Like if one drug's not covered, what other drugs could be covered, and be able to help them navigate through those things. So I'm going to share my screen for part of this just so you can be able to follow along and see some of the slides, and then I'm going to take it off as well so it can be more conversational. So if you have any questions, drop them in the chat. I've got both my phones up, so I should be able to see them there if it takes a minute for it to actually show up in this Riverside app that I'm using. So one of the reasons why it's important right now to become a Medicare insurance agent is because there's so many people that are aging into Medicare, folks that are turning 65. And so as you can see from this slide, there's 10,000 people turning 65 in the United States every single day. And these are just some headlines that I pulled where it says America's hitting peak 65 in 2024 as a record number of baby boomers are actually reaching that retirement age. They're calling it the silver wave, which I thought was funny, and then the silver tsunami. And it's saying a record high 4.1 million Americans actually turned 65 in 2024. And it's also showing this on top of the 66 million plus people that are already on Medicare and of Medicare age, or because they're disabled. So I do have a 4-part series for this on my YouTube channel. So it's a lot to get through, but I'm going to give you all the basics tonight. When you walk off this webinar, you'll absolutely be able to know everything you have to do to become a Medicare insurance agent. However, if you want to watch it again, or if you want to see it broken down step by step, you can go over to my YouTube channel at Renata J, and I took all 4 parts and broke them out. Okay. So part 1 is you've got to get your insurance license. All right. And this is usually about a 3-week process. And the reason is you have to do several different things in order for you to get this license. And so what I have on the screen now is the website that you can go directly to no matter what state you're in, and it is going to tell you everything that is required in your state. Okay, I also took all of this stuff and put it into a spreadsheet with the Department of Insurance information and the pricing information for how much does it cost to take the test. Are you required to do a prerequisite exam? All of that stuff is in this right here that you can grab, or you can go directly to this website and it has all of that information there for you too. Step one is determining which type of insurance license that you have to have. And in order for you to sell Medicare insurance, you have to have a life, accident, and health insurance license. Okay, that is important. So there's property and casualty, there's some other licenses, but what you're going to need is a life, accident, and health insurance license. Excuse me. So you're probably saying, how do I get one of those licenses, Renata? Well, if you're in the state of South Carolina, there's a number of criteria that you have to meet. Again, all of these steps right here are screenshots literally from that website that I showed you on the prior screen. You're going to have to be at least 18 years of age in South Carolina, be of good moral character, not have been convicted of a felony, and not convicted of a misdemeanor involving deception or crime involving finance or insurance within the last 5 years. Again, depending on your state, these could be different. That's why it's important for you to check out that website and it will tell you. Step 3 is completing the pre-licensing education course. This is not required. That's what you're going to see in red, okay? But I highly recommend. I took it. I went to Brewer Insurance School in Columbia, South Carolina, and they actually had a virtual course, and it's 4 days. So I went, I joined online for 4 days, Monday through Thursday, and then they recommend that you actually take the test as soon as possible. So I ended up taking the test on that Monday, and so that's why it's real fresh in your brain. The reason why I highly recommend you take some course is because for me, the life insurance part was so difficult. And I'm pretty sure people who may not have my Medicare experience would probably say the same thing about the entire exam, Medicare, life, all of it. And then there's a Kaplan course that is also online. I know somebody who worked with me last year. They took the Kaplan course, and it's self-paced, so you can log in at any time and take it. Some people get the book and they read through the book. Whatever works for you, go for it. But what I would not advise you do is to just try and go and sit down and take this test. And I think you're going to pass without having some kind of review material. To me, it made more sense to go through Brewer Insurance that had a 4-day program where you had to log in from 9 to 5 and then took the test shortly thereafter, which for me, I took it on that Monday. And then once you complete the prerequisite course, you got to go and you got to actually take the licensure test, okay? And this is the license test for your life, accident, and health insurance license. For South Carolina, it was $59 per attempt, okay? And whatever state you're in, again, I'm getting all this information from that one website. It will tell you how to schedule your test, where you're supposed to go to schedule your test, and how much it's going to cost. It was 130 questions and it had 10 pre-test questions, but it was $59 for you to attend. So I often get asked, Renata, how much does it cost in order for me to become an agent? Here's one of your costs right here. It's $59 if you're in the state of South Carolina to actually take the test so that you can get your licensure exam. Then, once you actually pass the test, congratulations. Once you pass the test, now you've got to complete your application to get your actual insurance license. This is all done through the National Insurance Producer Registry. Here's another fee. It's $25. NIPR, think about it if you're a pharmacist on here tonight, about like NABP, wherever they house all of our licensure information. This is the same thing that NIPR does. So right now, I'm licensed in the state of South Carolina, North Carolina, Georgia, and Florida. And so what happens is I can go into NIPR and see the status of all of my Medicare licensures right in one spot, okay? This is where you want to keep your address updated, your email address, everything you want to make sure is up to date in NIPR. And they'll actually also keep up with your continuing education credit, so you know that your license is in good standing, and when you actually have to renew, they'll send you a notice about it. Step 6 is you got to do a fingerprint and background check, okay? So depending on what state you're in, that's going to tell you where you got to go to actually get your fingerprints. In South Carolina, you got to go to Identigo, and that's the only way that you can actually get the only acceptable form of fingerprints that they're going to get. And so then you're going to have to pay for it. Here, what you see is it's $51.75 to initiate the background check. and then also for the fingerprint. So all there's another charge for you. So now we're up to about 59, 25, 60, 85. We're up to about 130, 140 bucks, not counting how much it takes cost for you to do the prerequisite course if you decide to take it as well. And then now all you got to do is wait. Okay, so you've already passed the life accident and health insurance test. You got your fingerprints done. You have gotten your background check done. You submitted your application to NIPR. So now you're just going to wait for them to approve your application and send you back all of your information, your license number. Part two is Medicare certification. So this is where a lot of people get excited. They're like, oh, I passed the life accident and health insurance. I got my insurance license. I'm ready to sell. Not quite. Because you're selling Medicare, there is going to be specific training that you have to do in order to sell Medicare products. This includes Medicare Advantage, Medicare Supplement, standalone prescription drug plans. You have to have this certification in order for you to be able to sell Medicare insurance. I take it through AHIP. AHIP is a course where you can actually go and it has all the required training for you to sell Medicare. The reason I use AHIP is because I sell for multiple carriers. If I only sold for one carrier, I could take whatever training they had in their certification. However, because I sell for about 5 carriers, I use AHIP. And then what happens is AHIP transfers my scores over to each of the carriers. So they know that Renata is passed all her Medicare certifications and now she can complete whatever training we have in order to be ready to sell. What you'll see about AHIP is it's 5 different modules, okay? Module 1 is just your basics around Medicare program. So what does Part A cover? What does Part B cover? What does Part C cover? What does Part D cover? How do people become eligible for Medicare? What are the benefits of Medicare? All that is the foundation stuff that's in Module 1. Module 2 is all about Medicare health plan. So now we're going into more depth about the actual health plan portion or medical side of it. And then module 3 is all about prescription drug coverage. My favorite part, of course, because I'm a pharmacist, but part 3 is all about prescription drugs. And then module 4 is going to go over all your marketing guidelines. There's a lot of things you can and cannot do when selling Medicare. And this is all to protect the beneficiary. So you want to make sure that you pay close attention in that section, because the last thing you want to do is to get your license, get ready to sell Medicare, and then you do something that is not in compliance, and then you lose your ability to sell Medicare. And then module 5 is enrollment guidance and for Part D plans as well as Medicare Advantage. So there's 5 modules. After each module, there is a quiz, okay? And then you're thinking, oh, well, I made it through all the modules. I made it through all the quizzes. I'm good. Nope, because there's also a final exam that you have to pass. Okay, so you complete all 5 modules, you complete all the quizzes, and then you have a final exam. You will notice you cannot move on to each module until the module before that one has been completed. Okay, so you have to do these in order. You have to pass each one in order to move to the next. Then once you've gone through all 5 modules, you've taken the final exam and you've passed, then it opens up the fraud, waste, and abuse and general compliance modules, which you'll complete, take a test, and then you'll get issued your certificate of completion. Download that certificate so you can save it for your records in case you need to pass it along to another carrier, but AHIP will automatically transfer those over if you have your profile set up correctly. This is just an example of what my scores were last year when I completed AHIP for the first 3. So I got an 80% on module 1, 95% on module 2, 90% on module 3. And remember, module 3 was the one on prescription drugs, and I didn't get 100, okay? It's okay. The cost of the test is about $175, but most carriers will give you a discount of about $50. So you're looking at about $150 to take the test. You have to get certified for Medicare, meaning through AHIP or the carrier, every single year. So this would be a cost that you're going to have every single year. This $150 if you get the $50 discount, or $175 if you don't. You usually only get a max of 3 attempts to actually take and pass. Okay, so you want to make sure that you're actually passing the exam, because what happens is a carrier can say you couldn't pass AHIP and get certified within 3 attempts, so they will not allow you to sell their products. The final exam has 50 questions, and you have to score a 90% in order for you to pass. And that 50 questions is spread out across all 5 modules. The fourth part, so now you've got your life accident and health insurance license. You've also passed AHIP and you're now Medicare certified. The next thing is you got to get contracted. So now when it comes to contracting, that means you want to work for one of the agents to sell their products. And we're going to talk about that. But before you can do that, you have to have errors and omissions insurance, okay? E&O insurance, liability insurance. It's insurance to protect you if you make an error. If you're a pharmacist on this call, you're very familiar with this. This is just your regular liability insurance, but you will have to have errors and omissions insurance specifically for selling these insurance products. And that costs, I think I paid like $140 for mine. I meant to check right before here, but I forgot. But I'll find out and put it in the comments. Now, you can be one of two type of agents. A captive agent is an agent who is only selling for one particular company. So if you only want to sell for Humana, you only want to sell for United, you only want to sell for Blue Cross, you would be considered a captive agent because you're only selling for that particular insurance carrier. Now, you could be an employee, so you can actually go and apply to be an agent at Blue Cross or Humana or United, or you can go on as a 1099 contractor. So I could have very well said, you know what, I only want to sell for one insurance carrier. And I could have went and just became an independent agent just with them and completed all of the contracting stuff myself and only sold for them. That makes me a captive agent. I, however, am an independent agent because I am able to sell across multiple carriers. So I sell United, Aetna, Humana, Blue Cross, and Devoted. Okay, so because I sell for multiple carriers, I'm considered an independent agent and I'm issued a 1099 each year. Now, you could very well go and say, I want to contract directly with each of these entities. I don't do that. I work under a broker. The broker I work with is Lurie Life and Health. And the reason I work under them is because I'm going to get the same commission as if I went directly to Humana and filled out their contract and got contracted with them. That broker works out what their own pay is from these insurance carriers, okay? I'm going to get my same commission, but I'm also going to get so much more. They make sure that you have all the compliance things in order. They keep up with what's going on in the industry. They have trainings that you can go to. So if you are in an area and you think you want to be independent, I would recommend, highly recommend, that you find a broker that has great auxiliary services to support you and also allowing you to keep 100% of your commissions because it's just going to be easier. They handle all your contracts. I do not have to go to each one of these 5 carriers and do my contracting. I fill out one W-9, I fill out one information sheet. They populate it all into their system. I get something to sign and DocuSign for each one, and that is it. Okay, so save yourself a headache and save yourself some trouble and find yourself a trusted broker that you can work under. Now, the last piece of it is you have to have carrier-specific product training and attestations. You're probably like, Renata, I know good and well there's not one more thing that I got to do, and it is. Okay, so you got your life accident and health insurance license. You passed that test. You've got Medicare certified. You've passed that test. You've got your E&O insurance, your errors and omissions insurance. Great. And now you got contracted through, let's say, 4 carriers. And now that you're contracted with them, you got to get trained on their specific products. And so that's what you'll do here. And those modules vary depending on who the carrier is, but they'll go over what products you're able to sell, what is their value add and their competitive advantage in the market. They'll go over what their networks look like. All that kind of stuff is a part of carrier specific product training. And then they have attestations, code of conduct, conflict of interest, all those type things that you'll attest to when you're actually signing up for the specific carriers. The fourth part of this I go over is client workups. I'm not doing that on this live. I'm actually going to give you some answers to some questions that I get normally. However, if you want to know how I actually work up clients, then please just head over to my YouTube channel, and I've got specific examples over there of how I actually work through that piece of it. However, what I wanted to do in this part was just to have a conversation. If you have any questions, please just drop it in the chat. But some of the questions I get asked often is, what does the Medicare insurance agent do? Okay, and so I literally my busiest part of the season is during annual enrollment, which is October 15th through December the 7th. I actually do not sell the rest of the year, okay, because this is something I just do totally part time. You can do this part time, you can do it full time. I do it on a very part time basis. I only have about 50 to 52 people on my books, I think, right now. I tried to get to 100, but to be honest, it's a lot of work if you want to provide great customer service to these folks during the year. And because it's not something that I do a lot of, I think 50 to 55 is probably where my sweet spot of where I'm going to actually stay. So during the off season, which we're in right now, what I'm doing is, especially since it's January, is calling to follow up with my people to make sure they got their cards. They didn't have any trouble at the doctor's office, at the pharmacy. I send out birthday cards to them. I'm doing a very better job of that this year. So I send those out. So it's just really maintaining and building that client relationship, because if you're not talking to them, they will pick up the phone, they will get coerced by somebody else, and they'll move not knowing that they actually have those benefits with you already. What qualifications do you need to be an insurance agent? You do not have to have any specific training outside of what we've already talked about. You don't have to be a pharmacist. You don't have to be a nurse. You don't have to do any of that. Okay, so that is very important, and that I want people to be aware of. Okay. How much does it cost? I get that a lot. We just talked about some of the costs. You got your insurance has a cost. You got the licensure exam cost, which was $59 for hours in South Carolina. You've got to do your fingerprints and your background check. That has a cost. So the startup costs are going to be a whole lot different than what it is to actually maintain. Now, in a maintaining stage, I had to pay the $150 every year for AHIP so that I can get recertified. I also have to do the Arizona emissions insurance. I have to get that updated, and also anything that you want to do from a marketing standpoint. So if you have marketing that you're actually paying for, then you're going to have to pay for it. So I buy lead lists sometimes. So if you do that, you're going to have to pay for it. Let's see, I got a question. When do you get educated about the updates to the plans for open enrollment each year? So that's a very good question. So what happens is the annual enrollment is October 15th through December the 7th, and all people that is in a Medicare plan, they have to have their information or annual notice of change by September the 30th. So all health plans have to have that mailed out to them by then. We as agents can get information as early as the first part of September, but we can't share that with anybody. So they call them first looks, is what they call them. So that we'll get information about what's going to be on the market the following year, sometimes as early as first part of September, but we can't share that information with the general public until after October the 1st. And some plans will even release teasers earlier than that, but sometimes it all depends. And this is me getting too technical because I've worked in this space, so I know why they can't release some of that early on, because they have to wait for CMS, which is the Centers for Medicare and Medicaid Services, to actually approve their benefits. So somewhere around end of August, first part of September, we're already getting these first looks. Great question. How do Medicare agents get paid? So we get paid from commissions, and we get paid directly from the insurance company. So the Medicare beneficiary absolutely never pays anything, okay? You cannot charge these people. You can't charge them a referral fee. If they try to tip you, tell them no. They can send you a nice thank you card, but the best thanks they can give you is to tell somebody, oh, what an awesome job you did, and send them your way, okay? So they pay nothing. We get paid directly from the Blue Crosses, Humanas, Uniteds of the world, okay? We get paid direct deposit. And so you get paid two different ways, or I guess we'll call it two different ways. If somebody is brand new to Medicare, meaning they just turned 65 or they're disabled and they've spent their 24 months and now they're Medicare eligible, those people are considered new to Medicare. And the rate for new to Medicare for selling a 2025 plan is $626. So you get that in a lump sum payment for anybody that you've signed up that's new to Medicare for 2025. And if they got a Med Sup plan and a PDP, you're going to get $100 for the prescription drug plan. And then the Med Sup payment just depends on how much that product costs. If you have somebody who is already on Medicare, but they choose to change plans to another Medicare Advantage plan or another PDP plan, we call this a like plan moving. So last year in the state of South Carolina, Humana was not in network for MUSC. So therefore, a lot of my business in Kershaw County, I had to move into a United plan. So because that was considered a like plan, United paid me $313 for everybody that I moved from Humana into United. Okay. Some of my people, like in Darlington County, who were not affected, they stayed in their Humana plan, and then the people I had in United that I didn't have to move. So I didn't get a lump sum payment for those folks in January. I continue to get a renewal fee each month. And so it's that $313 pretty much broken down across the 12 months. So it's about $25 and some change. So the big thing is we get paid by commissions. You get commissions based on if they're brand new to Medicare, you're going to get that one-time fee that is 620, what did I say, 626 for this year. And then it has gone up each year for the last 10 years. The commissions for insurance agents have gone up. So that's a good thing. And then if they stay with you, you continue to get those commissions every year, but now it'll be $313 for 2025. And they usually break that out every single month. Okay. So that's how we get paid directly from the insurance company. And then don't worry about too, like, well, does Humana pay more than Blue Cross? That's irrelevant because CMS, the Centers of Medicare and Medicaid Services, put out how much these folks can charge up to. Now they may pay you less. Like WellCare did not pay any commissions to any of their agents this year to sell their standalone Part D plan. Okay, but they can't pay higher. So don't think, oh well, if Humana is paying 626, will United give me 675? No, there's a ceiling to what they can actually pay up to. How do you find clients as a Medicare insurance agent? I get that often. So the way you actually get clients, for me, the best way is through word of mouth. And so if you're concerned, and I literally had somebody who followed my webinars last year, and they decided to sell last year, and they were like, if I can just get my parents on, I got my money back. And you're absolutely correct. If you can move your parents, your loved ones, 4 or 5 people over, even 2 people, you've gotten back probably your initial investment for actually doing the program itself. What I will tell you, and it happened to him, is as soon as you put your parents or anybody on, your grandparents or somebody from church, they are going to tell other people. And that word of mouth is just going to keep getting you more business. So when I started, my parents were the very first people I put on. Then I went to my aunts and put them on. And then I went to the church and I put those folks on. And then they went out and they spread it around. And those people just got referred to me. And that's how I kind of built up my book of business. Now, I absolutely recommend that you do social media. People will not know what you do and to come to you if you're not putting out that you're an actual Medicare insurance agent. So that's important. The other piece that you want to do is I have a YouTube channel. So if anybody has questions, it is straight focused on providing education to Medicare beneficiaries. That's getting it out there that I'm providing free value on how you should choose your plan and all this kind of stuff. And when it's time to actually become an agent, when it's time for them to actually pick a policy or an agent, hopefully they'll remember me and they will come and ask me to be their agent. And the other one is, what challenges do Medicare insurance agents face? I get that all asked a lot. And for me, the biggest part is losing your people throughout the year. Okay, some of these not telehealth, but like these telecommunication people that's calling your people all the time, like they will steal your folks. They will call them and they'll say, oh, Miss Jones, did you know you could get $3,000 in dental if you move over here? And your person will move if they don't, and they already have 3,000 in dental with the plan that you put them on. So that's one of the challenges. The other challenge for me is, because of some of those things and the shady business that people have done in those markets, it trickles over to the agents who are just trying to do a good job. So sometimes this market is highly regulated, and it gets even more regulated because, again, you're trying to protect the most vulnerable population, which is our senior citizens. And so there's a lot of things that, like right now, before you meet with somebody, you have to have a scope of appointment filled out 48 hours before you meet with them. It didn't used to be that way. You could literally sit down with me and we could fill out the scope of appointment form, and that was it. Now, there's a couple of exclusions around it, but you for the most part, you have to meet with those 48 hours. So that's the challenges, is just as highly regulated. And I think one of the challenges from people who are not in this space is getting past that life accident and health insurance exam and getting the Medicare certification itself. And then the last question, can you build long-term business as a Medicare insurance agent? Absolutely. So I'm doing it part-time, but there's people that do nothing but sell Medicare insurance. The other thing is you can sell other products during the year. So you might sell dental plans, hospital indemnity plans, all kinds of stuff that you can actually sell also, but it can very well be a full-time business that you do. So that's all I have. If anybody has any questions, please drop them in the chat. And I will be happy to answer them. I appreciate everybody for joining tonight. I'm getting used to doing this live and the technology that goes with it. So I really appreciate y'all's patience. If you have any questions, you know how to find me, you know how to reach out to me. I have lots of great information over my YouTube page. So if you have questions over there, please feel free to review those videos and look at and drop comments anywhere. I'm all over social media. You can find me. So I'm going to end it right there. So if anybody, again, if you have any questions, just drop it in the comments below and I will certainly reach back out to you. And if you're interested in selling and you just got some specific questions, just let me know and I'll be happy to answer. Thank you all so much and y'all have a good night.